Good afternoon, and thank you for joining us for TGH's Ask an Expert, a live Q&A series. I'm your moderator, Danielle Kachi, and I'm joined by Dr. Jessica Brumley, Associate Professor and Director of the Division of Midwifery at the USF Health Morsani College of Medicine, Department of Obstetrics and Gynecology. Thank you so much, Dr. Brumley, for being here today.
Thank you so much for having me.
All right. Well, it is National Midwifery Week, which brings us here today. So Dr. Brumley has a wealth of information on this topic, and we're fortunate enough to get her expert advice on all things midwifery. A few housekeeping notes first, though. If you do have any questions as we go along, be sure to place those in the comment section on either Facebook or YouTube where you're watching. We'll get to as many of those as we can as time allows. Plus, we have several pre-submitted questions that we'll get to. And a reminder that yes, Dr. Brumley is a medical expert, but make sure to always consult your primary care provider for individualized medical advice. All right, with that said, let's get started by setting the table for this topic with a general question. Dr. Brumley, first, why don't you explain what midwives do exactly and the role that you play on the care team?
Thank you. Well, midwives are really experts in supporting our healthy transitions through our body's normal physiologic events, from the beginning of our menstrual cycle all the way through menopause and beyond. We do have a special focus and expertise in healthy pregnancy, labor, birth, and the postpartum period. Midwives have been doing this since the beginning of time. And I often hear people say, oh, midwives are still a thing, or do they even exist? They do. There are over 800 midwives in Florida. There are several midwife credentials in the US. Our team at TGH and USF are all certified nurse midwives. Because we're fully integrated into our healthcare system, we can independently care for healthy individuals, but we can also collaborate with our physician experts. So this allows for the expertise of the midwife to be paired with the expertise in medically complex pregnancies or gynecologic problems. So our patients can have their prenatal visits with us while also having their diabetes managed by one of our maternal fetal medicine specialists.
So we have a whole team here that you guys are, I know, happy to be a part of. So we're very lucky here at TGH and USF Health. So first, what are some common high-risk situations that expectant moms might be able to prepare for and address?
I think of prenatal care as the opportunity to prevent complications, right? We really try and take this preventative mindset. And so coming in for visits, we talk about healthy diet and exercise and stress management, your nutritional needs in pregnancy. And we're also screening for complications like iron deficiency anemia or hypertensive disorders of pregnancy, probably two of the most common complications in pregnancy. But something as simple as inadequate iron intake in pregnancy can lead to significant iron deficiency. Because we know we'll bleed during our childbirth experience, someone comes into their labor and birth severely anemic, that hemorrhage experience, or even just slightly more than normal amount of blood loss can lead to a blood transfusion, or even, worse, a trip to the ICU. And so really having those regular visits and those opportunities for education and support throughout pregnancy, all of that helps to prevent complications. And I'd add one more thing. Having that relationship with your care provider, right? Coming in and meeting your midwife regularly over and over again allows you to feel better about the birth experience. It's that relationship that can really be therapeutic. And one of the things that we value as midwives is therapeutic human presence. Now, we know that labor and birth can happen any time of the hour, of day or night. And it may not be that one person on the team who's there when you come in labor. right? But the more opportunity you have to develop that relationship, the more we can build trust in the entire care team, feel more comfortable where you're going to labor, birth, who's going to be there, what the process looked like. So it's really some very basic things that can really help to decrease the risk of complications in pregnancy, labor, and birth.
Right. And I know a few moments ago you had mentioned nutrition, and we did get a pre-submitted question from our audience about how can you best manage weight gain when struggling with nausea and food aversion?
Absolutely. Nausea and food aversion is the number one most common symptom in pregnancy. It's a near universal experience. But how we respond to that seems to go one of two ways. Either I'm nauseous and I don't want to eat anything and I can't gain weight, or I'm nauseous and all I can eat are these limited foods that I can tolerate. And so, right, the cheesy bread, right, that I'm craving and all that seems to tolerate can lead to excessive weight gain. So it can be an issue with inadequate weight gain, or it can be an issue with excessive weight gain. And there are some basic things that I start with. And I know it seems counterintuitive, but eating small, frequent snacks or meals throughout your day is really critical at preventing hypoglycemia or low blood sugar, which can really trigger nausea and vomiting for individuals. And so, what often happens is this cycle of I'm nauseous and I'm not hungry, I can't eat. My blood sugar goes down, I don't eat, and so I throw up, and then I just kind of spiral throughout the day. For many people, it's worse first thing in the morning, but for some, it's all day, right? It's people call it morning sickness, and I say I know it's all day sickness, right? It was worse for me around 6 p.m. and I couldn't stand the smell of my husband cooking meat. So I couldn't cook the meat, but I could eat it if it was put in front of me, but I didn't want to smell it cooking. And so what I recommend is that those snacks be a combination of a complex carbohydrate. So a good carb, something that's got a little bit of fiber in it with a good source of protein. Now, because so many people have meat aversions, what I talk about are some of those non-meat sources of protein, right? So it could be an egg, it could be cheese, it could be peanut butter, hummus, it could, be trail mix, maybe a protein shake, and then mix those things with a piece of fruit, a celery stick or carrot, pita chips, whole grain toast, and just try and pair those things. Oh, the other thing that's really great is a nice healthy fat, right? I love a good slice of avocado, right? Avocado toast has been having a moment for probably the last, like, I don't know, 10 years, but it's a nice combination, right? Little bits of that every 2 to 3 hours. So mini meals throughout the day can help to maintain your blood sugar and help you to feel better throughout the day. You can try things like ginger ale, ginger tea. Ginger seems to be settling to the stomach. Acupressure bands, those like C bands that you can find at the pharmacy. Hit an acupressure point that can be helpful with nausea. And then there are medications. And so we have several different medication options. One that is available, that is a combination of over-the-counter medications, vitamin B6 and Unisom, right? The medication to help us go to sleep at night. All right, that combination seems to be helpful with basic nausea and vomiting of pregnancy. And then we can go down, if you're really experiencing vomiting, into a variety of different anti-vomiting medications that we can prescribe. Yeah, those are my general tips.
Well, good to know. Bottom line is the small meals or snacks throughout the day. So got those tips down. Another pre-submitted question that we got from one of our viewers is, what are some positions and techniques that can help ease pain and potentially shorten labor?
I'm just going to start with saying I teach a whole workshop on this for our labor nurses and our learners here at USF, because it is so critical and foundational, to the care that we provide in labor and birth. And it's not only positions, but also I mentioned before, feeling trusting of the team that's caring for you. It's really important that we have the skills as providers, to help you feel like we've got your back, that you're not with your tension up and ready to come in and do battle because you want to do things a certain way. You should feel like when you're coming in, you know that the people who are going to be caring for you understand your desires and preferences and your needs and are going to have your back from moment one. So that's the first thing. The environment matters, right? I talk about like using natural lighting. We want to make it as zen as possible, right? Helping you to be able to focus and relax so that your stress hormones are down. And oxytocin, the hormones that we worry about, what we think about in labor, some people call those the hormone of love, right? So we really want to be nurturing that experience. Change the lighting, address the temperature. We can do aromatherapy. You can bring in the support team that you want to be present, right? Knowing that the people who you want to be there are there with you. And then when it comes to position changes, it's all the positions, right? It's being able to move freely. It's being able to be upright, to be out of the bed. Laying in bed is the least comfortable position for someone in labor. Okay. Laying flat on my back feels better, said no laboring woman ever. Okay. So knowing that we have things like wireless monitors, or if you don't need continuous monitoring, being intermittently monitored in labor and birth. So you can be up, moving around, getting in the shower. We've got birth balls and peanut balls to help support you in different positions. Things like massage and counter pressure, things that we can teach your support people to help you with. And then again, a ton of positions to help keep your hips open and free to move, because the bones of your pelvis are not all just one solid bone. It's a joint. It moves. So we want to give it the freedom to be able to allow you and the baby to work together to have a faster, smoother labor.
Sounds good. And it sounds like a lot of people will get more tips if they sign up for one of your classes soon.
Yeah, or
So
I'd add childbirth education classes, right? The classes that are offered at Tampa General, they cover all of the different positions and tricks as well.
Great. And we'll get to all that information at the end here. We did want to encourage anybody who's watching right now, be sure to send in those questions in the comments section. We are looking to engage with you. You did touch a little bit on this, Dr. Brumley, about the team and a lot of the things that midwives do for our patients, but you don't just support the families through birth. There's other ways that midwives support moms throughout their life. Can you touch a little bit on that?
One of the joys of being a midwife is caring for the whole family. And there's no greater honor than when a patient of mine brings in their family member or loved one for a visit, right? And so sometimes it's their teenage daughter, right? Whose pregnancy I helped to support her through, right? 15 years ago. And now she's having her period, and maybe it's painful, or maybe she doesn't understand it, or maybe she just wants to be on birth control, right? And so they bring their daughter in and we have these conversations. A midwife is perfectly poised to provide education and support, and sometimes prescription management of the menstrual cycle. Also, once we hit 21, right, we need cervical cancer screening. So you want to get your pap smear, you can go to your midwife. Right? Once you're 40, right, you need your mammogram ordered in order to have your breast cancer screening. October is Breast Cancer Awareness Month. If you haven't had your mammogram, make sure and get that order for one and go get your mammogram. Again, this is part of well woman gynecology. Education and counseling on healthy behaviors, exercise, sleep, stress management. I talk to my patients about all those things, right? That is preventative health care. That's how we stay healthy. If you stop getting your periods, or you're getting to the point where you're about to stop getting your periods, and you're noticing you're having hot flashes, night sweats, you're waking up at 3 o'clock in the morning, you're having brain fog, your joints ache, I can go on. The list is extensive, right? You can talk to your midwife about your menopausal transition and the variety of ways that we can help to support you, through those transitions. And if things are getting more complicated, as I mentioned before, we can refer to our physician colleagues. If you need surgery, or if you need an ultrasound evaluation, those are all services that we offer within our healthcare system that we can help to. We can be that sort of primary care person, right, for you. Mm-hmm.
Right. Yeah. The midwives are definitely ingrained, in our program here. So that's good to hear. Let's go back to the birth journey.
Mm-hmm.
How can you support your loved one in their postpartum journey? So maybe some of what partners might be able to do.
Yeah, absolutely. This is one of my favorite things to talk to families about. Right? I like to say it in front of the dads when I'm rounding on, postpartum. Any family member wants to support their loved one, but they don't always know how. Right? I hear from a lot of moms that the family's coming over and they're ready to hold the baby and take care of the baby, but really what we need to do is hold the mom and take care of the mom. Because if we take care of the mom can take care of the baby. We need to feed them. The amount of time that they're spending, thankfully, most people are, breastfeeding, and most of our clients are breastfeeding. That's happening continuously, right? So we need to make sure that she's fed, that she is hydrated, right? That she gets a shower every day, that she gets a few minutes of sunshine and natural lighting. A little fresh air can go a long way. These are the kinds of things that can help to ease the transition into motherhood. And if you're the partner of a breastfeeding mom in the middle of the night, you can change the diaper, you can get the baby, you can bring it to her, you can do everything else that the baby needs, and then hand the baby off to her. Sometimes people feel like offering a bottle is maybe more supportive, but not if her preference and her goal is to exclusively breastfeed, right? So thinking about what's everything else that I can do for this baby so that she can try and get a little bit more rest. It is exhausting, like no one probably ever can explain until you go through it, emotionally and physically. So that's what I encourage. I also encourage moms to tell people, let them do your dishes, let them do your laundry, let them cook you food, right? We do tend to try and do everything these days, right? We're used to being so self-sufficient. This is not the time. It's not the time for that. Yeah.
It truly takes a village. So you realize that when you bring a kid into the world, and definitely, accept the help when you can for
Mm-hmm.
mamas out there. We do have just a few minutes left, but wanted to get to something. So at TGH and USF Health, we always hear this tagline almost about you saying where you birth matters. What does that mean for patients?
Well, I'd like to start with the obvious. Midwives matter, right? And what we know from the science is institutions that have midwives on their team have better outcomes overall. This is evidence-based. Where you birth matters because the hospital C-section rate will directly impact your likelihood of having a C-section. That's the strongest predictor of a C-section. In Florida, we have hospitals with C-section rates for low-risk pregnancies that are 20% higher than the recommendation. It doesn't make sense. This doesn't improve the health of the babies, and it increases the risk to moms. So know your hospital C-section rate. It's also important to know the level maternity center that your hospital is. So Tampa General is a level 4 maternity center. It's the highest designation. We're really proud of that. And that means that we're equipped to care for the most complex pregnancies. But if you're a healthy individual, you don't have to deliver at a level 4 maternity care center, right? Especially if the closest one is 2 hours away. That's not the best for you, but know the level of the maternity care center. Not every hospital has gone through that designation process, but the hospitals that do know what they can care for safely and know what they can't care for safely and can transfer out accordingly. So what I recommend is talk to your provider, tour the unit, talk to moms, talk to doulas in the community, right? Doulas that support moms at different hospitals are going to have the inside scoop, and they can help guide your decision making, right? Like they know what your preferences are, and they can go, you're not going to get that there, or you know what, you're at exactly the right spot, right, for what you want. So those are my recommendations.
That's great. Good info. I know another hot topic that you probably hear a lot about is VBACs, vaginal birth after C-section. So let's talk a little bit about that. What is it? What's the process, and how can midwives assist?
Yeah. Um, Vaginal birth after cesarean is just that, right? You had a C-section for any previous birth experience, and you'd like a vaginal birth this time. And most people can have a vaginal birth. I'd start with that. And most people who labor after a cesarean do end up having a vaginal birth after a cesarean. There are some people who we don't recommend it, depending on the type of scar on the uterus. It might be a much higher risk if the scar is on the part of the uterus that's contracting towards the top. And so having a good understanding of why we did the last C-section, what was your experience, seeing the operative report from the last C-section can help us to support you in your decision making. It should always be a process of shared decision making. It should even be presented as an option. There are hospitals where it's not offered for a variety of reasons. And so you should know that early on so that you have an opportunity to consider if you want to stay there and have a repeat C-section or go somewhere else that does offer vaginal birth after cesarean. That is something we're very proud of here at Tampa General and at USF. We support many people through their vaginal births after cesarean. And absolutely, the midwife can be your primary pregnancy provider during that time. We do ask all of our patients to meet with one of our physicians to review the operative report and engage a bit more in that shared decision making and consent process before they labor. And then we're there. We're there with you by your side. And in the rare case that you need a repeat C-section, our physician colleagues are there with us as well to be able to provide that safely for you.
Great. Good communication for our moms watching out there
Mhm.
ahead of time. Make sure you are chatting with your providers. All right. Well, thank you, Dr. Brumley, so much for your insight and awareness today about midwives. Lots of important information to get out there. So we really appreciate you being with us. If you want to know more about midwifery at TGH and USF Health and our care options, make sure to visit that web address on your screen, or you can scan the QR code to take you right there. Thank you to all who joined and submitted your fantastic questions today. We look forward to having you again on the next installment of Ask an Expert. Have a great rest of your day.